Answer. You're the president.
To formally declare the 22nd inaugural lecture of our esteemed institution open on this auspicious day, Thursday, December 5, 2024. Mr. Vice Chancellor, sir.
On behalf of the Council, the Senate, and all stakeholders of this university, I hereby declare this 22nd inaugural lecture open.
Inviting the Vice Chancellor to present Professor Asekun-Olarinmoye, a professor of reproductive and sexual health, to the which is titled Reproductive and Sexual Health, the Foundation of a Nation. The Vice Chancellor.
May I request Professor Asekun-Olarinmoye to stand up and remain standing. Professor Asekun-Olarinmoye was born to the family of Elder Ephraim Adeyemi Oshodina, Justice of the Peace, and Deaconess Abigail Tayo Oshodina, who were both certified practicing nurses during their lifetime. Professor Asekun-Olarinmoye attended Baptist Primary School, RIBG from 1962 to 1967, Adventist Grammar School ended 1968 to 1972, Adventist College of West Africa, Aswa, now Babcock University, for her freshman and sophomore college years, 1973 to 1975. She then proceeded to the Middle East College, Beirut, Lebanon, for her third year, junior year of college, 1975 to 1976, but had to leave Lebanon because of the civil war that broke out at that time. She obtained her first degree, the Bachelor of Science Honors, Biology, 1978. She also bagged a degree of Doctor of Medicine from Manila Central University, the Philippines, in 1982. At that time, in 1982, she was the first qualified medical doctor, male or female, from her hometown, Okinlao. She became an associate fellow of the National Postgraduate Medical College of Nigeria in 1992, and a fellow of the West African College of Physicians in 1996. Professor Asekun-Olarinmoye started her medical career during the NYSC years as medical officer in charge of Arema Maternity Center Ibadan, 1983 to 1984. She was transferred to the Pediatrics Department of Adeoyo Maternity Hospital, Yemetu Ibadan, 1984 to 1990. She left there to join the University College Hospital, Ibadan, for a residency training between 1990 and 1996. After which she became the medical director of the former Adventist Seminary of West Africa, Aswa Health Center, now Babcock Teaching Hospital, between 1996 and 1999. She was transferred from there to join the faculty of the postgraduate medical education at the Seventh-day Adventist Hospital in Ife, 1999 to 2001. She then returned to the university system in 2002 and worked at the College of Health Sciences, Ladoke Akintola University of Technology, Teaching Hospital from 2002 to 2010, where she served as head of department, college university orator, residency training coordinator, member of several faculty, college and university committees. She then moved to Osun State University as an associate professor in the year 2010. At Osun, Professor Olarinmoye served as acting head of the Department of Community Medicine, acting director of Quality Assurance, director of Research and Linkages, chairman Ceremonials Committee, provost College of Health Sciences, chairperson and member of several faculty, college and university committees. A round of applause for her. Professor Olarinmoye Dori attended as chairperson of University Ceremonials Committee, made history for being the first of such of return that left over unspent fund of over 4 million naira to the university coffers. That attracted commendation from the governing council of this university. She was promoted to the rank of full professor in 2013, and she taught full-time at the university level for 23 years. She's currently a professor of sexual and reproductive health in the Department of Community Medicine of this university. She has successfully supervised 3 degrees of Doctor of Philosophy, 23 fellowships of the College of West African Physicians and the National Postgraduate Medical College of Nigeria. She served as external examiner undergraduate for the Obafemi Awolowo University, the University College Hospital Ibadan, as well as LAUTECH, both for PhD and for master's degrees, and also at the University of Namibia, Windhoek, Namibia. She has also served as external assessor for professorial candidates for promotion in several universities, both Nigeria and outside Nigeria. She has been peer reviewed for local, 6 of them, and 21 international scientific journals, including serving as guest academic editor for PLOS Global Health Journal, guest article editor for Sage Open, assistant editor for Research Journal of Health Sciences of our university, past co-editor of the Western Nigerian Journal of Medical Sciences, and past editor of the Adeleke University Journal of Health Sciences and Biomedical Research. She is a member of the Governing Council and Board of Trustees of Adeleke University Ade, member of the Board of Seventh-day Adventist Hospital in Ife, member of the Board of SDA College of Technology, and she is the immediate past director of Health Ministries for the Seventh-day Adventist Osun State Conference for the past 2 years pro bono without collecting a kobo from the Seventh-day Adventist Church. Mrs. Olarinmoye continues to contribute to filling the gaps in knowledge of major children's health and reproductive challenges. Among women and adolescents, she was the first recipient of 2 TED Fund research grants. She has authored more than 80 scientific research articles. And her current research is on saving lives of mothers and babies at birth. Ladies and gentlemen, happily married to a sweetheart for 40 years before he rested in the Lord. A great family blessed with 3 successful children and 3 grandchildren. I invite you on behalf of the Senate of this University, Professor Esther to present the 22nd inaugural lecture of this university. Thank you.
Your Excellency, the Governor of Osun State, the Vice Chancellor, the Deputy Vice Chancellors, the Registrar and other Principal Officers of the University, members of the University Governing Council, Provost of the College of Health Sciences, and Provost of other colleges, Dean of the Faculty of Clinical Sciences, and Deans of other faculties, Directors of centers and units, Heads of departments, and Head of Department of Community Medicine, Professors and other members of Senate, members of the academic staff, members of administrative and technical staff of the university, Your Royal Highnesses, members of my family, church, and friends, distinguished invited guests, gentlemen of the print and electronic media, great students of Osun State University, distinguished ladies and gentlemen. Preamble. Praises, honor, and glory be to God Almighty, the creator of heaven and earth. I am greatly privileged and grateful to God for his opportunity, and I offer my humble gratitude to God for this great grace that he has given me. I also sincerely appreciate the Vice Chancellor and the entire management of this university for this wonderful opportunity. This is indeed a memorable day for me, as I deliver the 22nd inaugural lecture for this great citadel of learning titled Reproductive and Sexual Health, the Foundation and Pillars of the Nation. By the special grace of God, I am the first professor in the Department of Community Medicine, as well as the Department of Public Health in this unique university. This inaugural lecture marks the first of its kind for both of the departments aforementioned. I have eagerly anticipated this opportunity. This indeed is a day the Lord has made, and we shall rejoice in it. From my earliest recollections, I have always wanted to be a medical doctor, probably because I was raised by parents who were both nurses and had their own very successful private practice. With this in mind, it made me want to take the bar a notch higher. The journey started from little beginnings at Baptist Primary Day School, Reproductive, to the Adventist Grammar School, Ede, and then the Adventist College of West Africa. Thereafter, I left the shores of the country with my parents willing to grant me a foreign education. The plan was to complete my first degree at the Middle East College, Beirut, Lebanon, and proceed to the medical school at the American University of Beirut, Lebanon. However, this was truncated by the ongoing civil war there at that time. Hence, I proceeded to the Philippine Union College, Manila, where I bagged my first degree in biology and my second degree, an MD, a Doctor of Medicine, from the Philemon Tanchoco Medical Foundation, Manila Central University, Manila, Philippines. This was the fulfillment of my childhood dreams, which made me the first medically qualified doctor, male or female, in my hometown of Okela, the solid foundation for me to be able to make good impact upon my return to Nigeria until this very moment. Notwithstanding the various adversities that I have encountered today, to the glory of God, I am privileged to stand here as an associate fellow of the National Postgraduate Medical College of Nigeria and a fellow of the West African College of Physicians. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not just merely the absence of disease or infirmity. This WHO definition of health introduces the concept of well-being. Well-being is not just the absence of disease or infirmity or illness. It is a complete combination of a person's physical, mental, emotional, social, cultural, economic, and spiritual health factors. Well-being is strongly linked to happiness and lifetime satisfaction. As such, well-being could be described as how you feel about yourself, about your life. Mr. Vice Chancellor, sir. Health is the most crucial element of life. It is a resource of everyday life and a positive concept emphasizing physical capabilities. Until and unless a person is healthy, he or she cannot be really happy, no matter how wealthy he or she is. Thus, giving rise and credence to these well-known quotes, health is wealth. Reproductive and sexual health, which includes maternal health, child health, and adolescent health, is a special subspecialty of community medicine. Reproductive health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and its functions and processes. Mr. Vice Chancellor, sir, my research interest has been majorly on child health and reproductive and sexual health of women and adolescents. These target groups are very important because looking at the demographic pictures of the world, they make up about 2/3 of the population, the total population in low-income countries, accounting for the highest mortality rates in these countries. Mothers and children constitute high-risk groups with interrelated problems due to the close relationship between mothers and children. Indeed, the health of the next generation, the growth and survival of a nation depends on the successful childbearing and child-rearing practices of its citizens. Furthermore, maternal health is a major determinant of family health status. Also, the family is, of course, the basic unit of any society, which eventually adds up to constitute the nation. Maternal health. Maternal health refers to the broad currently accepted means of providing promotive, preventive, curative, and rehabilitative health care for mothers. It refers to the health of women during pregnancy, childbirth, and postpartum period, and it is a very important component of reproductive health. Maternal health in developing countries and economically restrained settings remains a daunting and largely unmet global public health challenge. Therefore, there is still existing a high prevalence of maternal deaths in low-income countries, including Nigeria, the cause of which is multifactorial. Mr. Vice Chancellor, sir, my contributions in the field of maternal health include research works on gender-based violence, intimate partner violence, violence against women, sexual assault, domestic violence against men, sexual high-risk behaviors, partners of brothel-based sex workers, community attitudes to HIV and people living with HIV/AIDS, consumer perception of quality of ANC services, breast cancer, contraceptive use and barriers to its use, and the role of men in reproductive health, sexual health, gender-based violence. Violence against women continues to occur in many countries of the world, despite legislative, administrative, judicial, and other measures to stop it. The media is a very powerful tool. It can shape people's minds, attitudes, and perceptions. It can help to organize society by offering direction. Despite the important role of the media, what they can play to end violence, there is a paucity of information on violence against women and the Nigerian media. In collaboration with a colleague, investigations into media practitioners and gender-based violence in Ibadan, Nigeria was conducted. This study highlighted the gaps in knowledge, negative attitudes, and poor practices among the media practitioners. This is highly undesirable and unacceptable in a group that is supposed to be the enlightenment drivers of the society. We therefore recommended that the media practitioners themselves first need comprehensive training in violence against women with regular intermittent training and use of peer educators. This will engender appropriate increased coverage of prevention against violence against women and in the media and the dissemination of unbiased information. My studies in the area of intimate partner violence showed there is still high prevalence of intimate partner violence in the sub-Saharan African region, with men having incorrect perception on the issue. For example, many of us will remember the very prominent case reported in the media of a lady banker in Lagos whose husband murdered her, chopped her up, and stored her in the freezer after many incidents of intimate partner violence. Our findings among married men in Ibadan, Oyo State, Nigeria, showed prevalence of various forms of violence, as we can see on the slide. We have psychological violence, emotional violence, physical violence, sexual violence. That's what we found in the study going on in the society. Unfortunately, growing up in a violent home has negative effects and intergenerational repercussions on children and adolescents. One of the strengths of this study that we conducted is that it is one of the first studies that assess men's perception, motivation, and predictors of IPV in sub-Saharan Africa. We recommended raising public awareness and the implementation of multiple interventions to stop intimate partner violence in Nigeria. Generally, it is assumed that violence against women is the only issue of concern, and that men are always the perpetrators, and that they are never victims. In collaboration with colleagues, I investigated whether domestic violence against the Nigerian man in this 21st century is a myth or a reality. In the study that we conducted, wives and in-laws were the most commonly cited perpetrators. That is, the perpetrating domestic violence against men, the Nigerian man, in the 21st century. A quarter of the men in our study had ever been victims of domestic violence, and only 3/4 of these victims sought for help. Perceived barriers to seeking for help included pride and embarrassment and shame. Mr. Vice Chancellor, sir, the study showed that domestic violence against men is a reality in Nigeria, in spite of cultural underpinnings. We recommended that more research is needed in this area to improve understanding on the contextual differences, power dynamics, and the impact between male and female experiences in intimate partner violence. Given the current economic climate that we are in Nigeria now, this places significant financial burdens on the male breadwinners, and I suspect that this is a contributing factor to increasing the prevalence of domestic violence against men in Nigeria. We also continued our studies. Just as media practitioners, that is, the journalists, constitute an important target group in the bid to stop gender-based violence, similarly, law enforcement agencies such as the police are another important target group. Law enforcers need to be knowledgeable about gender-based violence. Therefore, an intervention study was carried out among police officers in Osun State. Following the educational training workshop, the knowledge of the police officers on gender-based violence prevention improved. Prevalence of partner or wife violence among the police officers themselves was 9% pre-intervention, which reduced drastically to 3% post-intervention. HIV/AIDS. The need to encourage men to make responsible decisions, especially in sexuality matters, is of paramount importance. Generally, reproductive health research among men who patronize commercial sex workers have been neglected in most of the African countries, including Nigeria. Yet, the men form an important link between these commercial sex workers and their regular partners or wives, with whom these sex workers have no direct contact. We conducted a community-based study to characterize partners of commercial sex workers by risk behavior, level of knowledge, and attitude to HIV/AIDS among male executives, and to assess factors which include the risk for HIV infection. We found that the age range of men that patronized these brothel-based sex workers was between 17 and 71 years, median age at 28 years. About half of the men were already currently married, and over half, like 95.6% of these men were HIV positive. Usage of protection, that is condom, was very low, especially among the married men. Predictors of increased risk of infection were ever had penetrative sex with a sex worker and having homes and offices within 2 kilometers of a brothel. Findings showed that male partners are at higher risk of HIV/AIDS, and it is necessary to address both the sex workers and their male partners. The commercial sex workers constitute a risk to the men with whom they have unprotected sex, and vice versa. Also, by extension, to the wives and partners of these men, the innocent wives and partners. The lesson here to note is that this situation does not necessarily apply to only men that patronize commercial sex workers. It can also be extrapolated to situations of either gender, having multiple sexual partners, as in men having side chicks, women having sugar daddies, young people in relationships with various friends with benefits. All these irresponsible acts may cause havoc or loss of life to the unsuspecting innocent partner. So, a wake-up call to take responsibility for your life and the life of your partner. In another community-based study among rural adult population in southwestern Nigeria, results showed a rural adult population whose high level of awareness, knowledge of HIV infection transmission and prevention measures were at dissonance with their poor self-risk perception of HIV infection and risky sexual behavior, thereby putting them potentially at higher risk of HIV/AIDS. This confirms that the knowledge, that having a knowledge about something does not necessarily translate to behavioral change. Risk reduction strategies, in addition to the promotion of reduction of numbers of sexual partners, emphasis on comprehensive knowledge of HIV infection transmission, are preventive measures advocated for this target group. In spite of efforts to control HIV/AIDS in Nigeria, it remains a disease of public health concern and importance. Interventions aimed at combating the disease should be multi-sectorial. Religious-based initiatives are pivotal to the success of prevention and care efforts across the globe, as well as in Nigeria. However, faith-based organizations are often overlooked by program development planners. This prompted us to investigate and assess the perceptions and activities of religious leaders in the prevention of HIV/AIDS and care of people living with HIV, the virus. We found that the religious leaders had a very high level of knowledge on the routes of transmission and modes of prevention of HIV, and also had positive attitudes towards people living with HIV/AIDS. They educate, they inform, and they raise the awareness of their congregation on HIV preventive measures. We found that if properly harnessed, religious leaders can be vital instruments in the control of HIV/AIDS in Nigeria. In collaboration with co-researchers, we assess the community attitude towards the reproductive and sexual life of people living with HIV/AIDS in Olaruda local government area of Osogbo, Nigeria. In the desire to have children, the intersection between HIV positive status and childbearing can be very complicated. Our findings showed that a significant proportion of the respondents, more than half of our respondents, opined that people living with HIV/AIDS have no rights to continue having sex, to get married, or even to bear children, even with safer-sex technique. This sexual and reproductive discrimination corroborates results from studies elsewhere. These findings suggest that the sexual and reproductive health rights of HIV-infected women and men may be an important target as part of efforts to reduce HIV/AIDS related stigma. A redirection of policy guidelines towards resolving community stigmatization and discrimination against people living with HIV/AIDS is needed. Long-distance traveling is also being implicated in risk factor in HIV infection. Drivers are more at risk because they leave their families frequently and therefore they resort to satisfying their sexual needs by patronizing commercial sex workers and engaging in casual relationships with female hawkers at stop stations. Studies have shown that despite high-risk behaviors, long-distance drivers consider themselves at low risk and so they do not take preventive measures to protect themselves. Our study, therefore, carried out to evaluate the effectiveness of health education in improving HIV knowledge and high-risk behaviors of commercial drivers in Ilorin, Nigeria. Post-intervention, there was significant improvement in knowledge of means of HIV transmission, reduction in the practice of some risky sexual behaviors, and an increase in uptake of preventive practices among the commercial drivers. This study demonstrated that health education is effective in improving HIV knowledge and engendering change from practices of high-risk behaviors to health-promoting and health-protecting behaviors. We recommended that continuous health education programs and seminars on HIV preventive practices, utilizing innovative approaches based on the peculiarities of their occupation and behavioral tendencies, be organized by NGOs and ministries of health for the drivers and the motor parks to equip them with more knowledge and skill to protect themselves from infection. Reproductive health. Men's involvement in reproductive health is crucial through their participation in reproductive health, although their participation has been poorly demonstrated. In Nigeria, where culture is an important factor influencing women's access to availability of reproductive health facilities to these women, there is a paucity of data on men's view on maternal health. In our study, we found despite good knowledge and positive attitudes of male respondents towards maternal health care, their involvement in the health care of their wives was low, as less than a quarter of our respondents had ever followed their wives to family planning clinics, antenatal clinics, and delivery rooms. I think we can relate to this, the men that are here. Enlightenment programs is advocated to stress the involvement of men in promoting maternal health care and also being agents of change in improving the quality of life of women, and as it relates to maternal health, thereby bringing about healthy families and indeed a healthy nation. Furthermore, we investigated the barriers to use of modern contraceptives among women in an inner city area of Osogbo metropolis, Osun State, Nigeria. Our study found that majority, that is 90.3% of respondents, had high awareness of modern methods of family planning, but we found very low utilization at only 13.1% of respondents being current users. We can see that the level of knowledge is at dissonance with their practice. The commonly perceived barriers accounting for low usage of family planning methods were fear of perceived side effects, ignorance, misinformation, superstition, and culture. Cancer in women is another issue of public health importance because of its high prevalence and mortality in diverse populations. Breast cancer is the most common malignancy in women worldwide. In Nigeria, it accounts for 22.7% of all new cases of cancer among women. Women with cancer of the breast seeking medical help late is a common occurrence in low-income countries. We therefore decided to examine if education and environment play a role in cancer screening. We found that the available screening methods of self and clinical breast examinations were practiced by less than half of our respondents. Furthermore, only a third will give consent for mastectomy, even if need be. About 3/4 have a very deep fear of the disease. The study found that despite a relatively high literacy level in our study group, knowledge of etiological causes of breast cancer, including risk factors, was very low. And also, the knowledge and attitude to symptoms. Therefore, efforts should be made to upgrade the knowledge of our women through information, education, and communication on cancer of the breast and the consequences of late presentation. The antenatal period presents critical opportunities for reducing the mortality and morbidity rates of pregnant women in Nigeria. Quality of care is one of the major public health concerns in the 21st century. The new approach to ANC also emphasizes the quality of care rather than the quantity. Perceived quality of care received in health facilities is directly proportionately related to the use of the health facilities. In our study, we found that respondents' assessment of overall quality of ANC care was said to be satisfactory. However, major point of dissatisfaction is the length of time spent in the ANC. This was corrected to ensure increased and continued utilization. Child health. Children's health, the nation's wealth. Children are vital to the nation's present and future survival. Children have begun to be recognized not only for who they are today, but for their future potentials and roles in creating families, powering the workforce, and making the country's democracy work. Mounting evidence that health during childhood sets the stage for adult health not only reinforces this perspective, but also creates an important ethical, social, economic imperative to ensure that all children are as healthy as they can be. Healthy children are more likely to become healthy adults. Child health ensures that children remain fit and healthy and that they achieve optimal growth and development both physically and mentally. Mr. Vice Chancellor, sir. My contributions into the field of child health started very early in my professional career as a physician and an aspiring academic. Protein energy malnutrition, you can see the picture of malnourished children on the next slide here, remains an important cause of high morbidity and mortality in most developing countries, including Nigeria. With this in mind, a study was carried out on the prevalence of protein energy malnutrition, PEM, among children attending a secondary health facility institution in Ibadan over a 27-month period. Our study found a strong seasonal influence on the prevalence, of admissions, outpatient and inpatients of PEM. It is a well-known fact that availability and prices of food varies with seasons in Nigeria. Our study showed that seasonal availability or scarcity of new nourishing food items that occur during the wet season, just before the onset of harvest, are among important contributing factors to the seasonal variation of the prevalence of PEM. Effective methods of food preservation and storage will contribute to the prevention of PEM, and this also highlights the importance of the multisectorial approach, which is a rational approach to preventive medicine as recommended under primary health care. Another aspect of interest in child health is the increasing number of Nigerian women in the labor force, coupled with the gradual disintegration of extended family system, which gave rise to the demand for alternative means of caring for children. Daycare centers as an alternative source of childcare has become a necessity rather than an option. A comparative study was conducted to assess and compare the health status of two groups of children under the age of 2 years that were cared for in two different rearing environments, the home environment and the daycare center. Daycare attendance was found to be a significant risk factor associated with the occurrence of diarrhea and upper respiratory tract infections in these children, and showed that children placed in groups of other children at external care centers experienced more illnesses than their peers who remained at home. Disease transmission can be minimized by infection control behavior. Placing children, however, in daycare centers should not compromise their health. Therefore, adoption of infection control behaviors and regular supervisions of daycare centers by appropriate authorities were recommended. We further investigated the effect of rearing environment on feeding patterns of underage children, Nigerian children, in home and daycare environment. Our findings showed that the feeding patterns of children in both groups consisted of poor feeding practices, early initiation of complementary feeding, and short total duration of breastfeeding. The study also showed that putting children in daycare centers may militate against the mothers being able to practice exclusive breastfeeding and may also affect total duration of breastfeeding. We therefore concluded that the type of rearing environment has an effect on feeding patterns of children. Health education of both mothers and health professionals and provision of daycare centers by companies, institutions, hospitals, and schools within their premises has suggested towards improving the rearing environment of children and their health. Another cause of high morbidity and mortality in children in the developing country, including Nigeria, is neonatal infections. In a community-based study on neonatal and perinatal mortality rates and factors in rural southwestern Nigeria, we found low birth weight, sepsis, and maternal death as the commonest causes of mortality in this age group. We concluded that neonatal deaths contributed significantly to the high infant mortality in this rural community. The services provided by the traditional attendants, that is the TBAs, were not optimal, but appeared to be better than having no one in attendance at all. TBAs, therefore, need to be trained to identify and promptly refer neonates at risk. Obstetrics and public health services need to be available and accessible at the grassroots level. Based on the knowledge that infectious diseases are prevalent and endemic in Nigeria, with fever as the commonest symptom, we assess the accuracy of tactile examination, that is feeling the body's temperature by hands. Usually most of the mothers do this, as a method of fever determination in their children by mothers in poor research settings. Thus, we determined the reliability of mothers' history about the presence or absence of fever in their children, as in the table that we can see up here. The concept used there is sensitivity and specificity of a screening test as we used it. Our results showed that tactile examination was found to be adequate for mothers as a means of detecting fever in their children. Therefore, physicians should therefore be more inclined to accept a mother's account of fever in her child as reliable and provide prompt management. The hand are central to many of our daily activities. The use of contaminated hands for cooking and eating enhances transmission of germs into the body through food, thereby causing ill health. Mothers serve the dual role as being their children's nurses as well as household chefs. This, coupled with poor knowledge and lack of hygiene practices, increase the risk of spread of infection and diseases to the under 5 children. In a community-based survey in Ibono area of Olorunda local government in Osogbo, we found that more than 3/4, 81.6% of the mothers did not think that the use of soap was important in hand washing. The study found many respondents showed positive attitude in favor of hand rinsing. To realize the health benefits of hand washing, efforts to improve hand washing in this environment should encourage adding soap to the current hand rinsing practices. Of the 24 million children born each year in Africa, almost 5 million, 16.6%, will not reach their 5th birthday, even though over 50% of these deaths are preventable through immunization, growth monitoring, and timely intervention. The mortality rates among Nigerian children remain unacceptably high. Disturbances in health and nutrition, regardless of their etiology, almost always affect growth. Thus, growth assessment has been said to be the single most useful tool for defining health and nutritional status in children at both the individual and population levels. Growth monitoring and promotion has therefore been advocated worldwide as one of the key elements of child survival and primary healthcare strategies. However, the success of the growth monitoring and promotion strategy depends on the knowledge and the expertise of the primary healthcare workers. Therefore, we assess the PHC health workers' knowledge, attitude, and practices regarding monitoring of the growth of the children in this environment. We say that this is the growth monitoring chart, the road to health chart as we use it at the primary health care level. The study highlighted the dissonance between the high level of awareness and the positive attitude to growth monitoring and the growth chart by majority of the primary healthcare workers, and the poor level of knowledge the workers had about the growth monitoring procedures, and more importantly, its interpretations, showing the need for training and retraining of all cadres of PHC workers in Nigeria. Adolescents in reproductive health, the forgotten and neglected link. The World Health Organization identifies adolescence as the period in human growth and development that occurs after childhood and before adulthood, from ages 10 to 19. It is a unique stage of human development and an important time of laying the foundation for good health. As children up to the age of 18, most adolescents are protected under the Convention of the Rights of the Child. Yet, their vulnerabilities and needs are distinctly different from those of children, and therefore remain unaddressed. Despite being a very healthy stage of life, there is significant death, illness, and injury in the adolescent years. However, much of this is preventable and treatable. Also, half of all mental health disorders in adulthood start by the age of 14, and most cases are undetected and untreated. Mr. Vice Chancellor, sir. Promoting health practices during adolescence and taking steps to better protect young people from health risks are critical to the prevention of health problems in adulthood and for the country's future health and social infrastructure. During this phase, adolescents establish patterns of behavior which may be related to diet, physical activities, substance use, and sexual activities, which can protect their health and the health of others around them, or put their health at risk now and in the future. As they transit from childhood to adulthood, adolescents acquire the physical, cognitive, emotional, social, and economic resources that serve as a foundation for health and well-being later in life. This is also a vulnerable period in which girls and boys are exposed to new risks. It is a period in which gender norms are consolidated, often to the disadvantage of girls. The health and well-being of adolescents are fundamental to the country's social and economic progress. There are 1.3 million adolescents in the world today, more than ever before, making up 16% of the world's population. In Nigeria, adolescents make up 19 to 22% of our massive population, showing that they are a sizable chunk of the country's population. My contribution to adolescent health. In an effort to identify the factors influencing the level of knowledge of sexuality among adolescents in Nigeria, we conducted a study in which knowledge, attitude, and perception of teacher roles in sexuality education of secondary school students were assessed. We found that the knowledge on key reproductive health issues are inadequate. The teachers exhibited poor perception of their roles in family health education and of their students. Education and reorientation of teachers were recommended. To assess the local pattern of health risk behavior among adolescents and young people, as well as guide in the choice of intervention to appropriately combat the situation among this target group, we conducted a study to determine the health risk behaviors of undergraduates in southwestern Nigeria. Our results showed that students indulge in health risky behaviors such as alcohol abuse, cigarette and marijuana smoking, and other narcotic drug use. They were also involved in unsafe sexual practices, like having multiple sexual partners, patronage of commercial sex workers, and low rates of use of condom during casual sex. And there was a growing experimentation with dangerous sexual acts that we found out. We recommended comprehensive health education intervention programs to promote positive behavioral changes among these students. These targeted interventions should involve partnership with school authorities and other local community stakeholder groups. Unintended pregnancies is a major challenge in reproductive health in low-income countries. Nigeria currently has one of the highest rates of maternal mortality rates in the world, and up to 30% of these maternal deaths are due to complications of unsafe abortion as a response to unwanted pregnancy. Emergency contraception refers to a group of birth control modalities that, when used after an unprotected intercourse and within defined time limits, can prevent an unwanted pregnancy. Emergency contraception, that is EC, has been found to be a safe, effective, and cheap way to prevent unintended pregnancies. However, EC is largely underutilized worldwide. We investigated college students' knowledge and attitude to EC in Osogbo metropolis and found that emergency contraception, that this modality is an untapped resource among this group. Results showed fairly high awareness, good general but poor comprehensive knowledge, especially about appropriate timing of usage, negative attitude translated into low level of usage of emergency contraception among the studied population. The study they reported high occurrence of premarital sexual activities and poor use of EC among Nigerian undergraduates. Calls for EC as a second chance approach if the incidence of unintended pregnancies and clandestine abortions are to be kept to a barest minimum. To reduce the gap between knowledge and utilization of emergency contraception, it is recommended that initiatives on health education should be targeted at students to address specific areas of poor knowledge and clarifications of common misconceptions about emergency contraception. The influence of media portrayals of sexual attitudes and normative expectations of young people at a critical development stage is of public health concern. Therefore, we examine the role of mass media and internet utilization in shaping the sexual health attitudes and behaviors of young undergraduates in Osogbo metropolis. We found that uncontrolled exposure to mass media and internet could negatively influence the sexual patterns and behavior of youth. Predictors of having multiple sexual partners include the gender of the respondents and the frequency of internet use. Sexual health, when viewed affirmatively, requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion and discrimination and violence. In a review of hospital records of victims of sexual assaults over a period of 7 years at the State Hospital to Osogbo, results reveal that sexual assault is a public health issue of importance in this environment. The yearly case presentation showed steady increase from 0.7% in 2003 to 3.6% in 2009. Results also showed that children and adolescents constituted almost 3/4 of all the reviewed cases. The implication of this finding is that adolescents and young adults are most at risk for sexual violence in this region. Furthermore, the perpetrators of sexual assault on women in our study included blood relatives, neighbors, acquaintances, authority figures, and strangers. This is an important point to note by parents, please, and guidance, who entrust their words to neighbors, friends, distant uncles, cousins, and many others. Adolescents also need to be safeguarded when relating and interacting to the opposite gender. Furthermore, society needs a shift in mentality from victim blaming to prioritizing perpetrator accountability. No external factor should excuse or justify a perpetrator's lack of self-discipline or self-control. Of great concern is the fact that discussions about sex, especially with children and adults and adolescents, is considered a taboo in many African communities. Yet, age and culture-appropriate sex education is probably the most cost-effective intervention by which young people can protect themselves against abuse, exploitation, unintended pregnancies, sexually transmitted infections, including HIV/AIDS. Views regarding sexual education as taboo arise from the mistaken belief that exposing adolescents, giving them access to knowledge about sex, encourages sexual activities and promiscuity. Thus, parents not only withhold vital information, but sexuality and reproduction information from their children. They also impart messages of danger, fear, and shame. On the other hand, children avoid talking to their parents about sexual matters for fear that curiosity about sex and sexuality issues will arouse unnecessary suspicion about their behavior and intentions. Most young people, however, learn about sex and related topics from books, magazines, film, television programs, internet peer group, and all these result in potentially unbalanced information with poor quality. This misinformation puts them at risk of sexually transmitted infection, including HIV/AIDS, unplanned pregnancies, unsafe abortion, and its related complications. Consequently, to gain more insight into these issues, my research group investigated parental attitudes and practices of sex education among children in Osogbo local government area, their expectations on school sex education, and the practices and content of sex education among adolescents in the family setting in rural southwestern Nigeria. In these studies, we found that though most parents wanted their adolescents to have knowledge about sex education, the practice is not well established among these parents due to lack of skill in communicating sex information to their adolescents. Also, poor attitudes to parental communication on sex was associated with high likelihood of premarital sex. Curiosity about sex and their sexuality was the most common reason for early sexual debut as reported by the adolescents. This emphasizes the importance of early sexual education within the family setting and its importance, and it is possible to have an impact in delaying sexual initiation. Promotion of parent-child communication about sexual issues is vital in order to improve the reproductive health of adolescents in this environment. We recommended that Community-based sexuality education programs should be organized for parents to improve their skills on communicating sex and sexuality education in their children. Sex education should be introduced into the school's curriculum with all stakeholders, parents, teachers, governments coming together to improve the curriculum. In another study, we explored the perceived reproductive health problems among in-school adolescents, determine health-seeking behavior, assess knowledge of available reproductive health services, and identify existing barriers to its access. The most commonly perceived adolescent health problems included menstrual problem, unwanted pregnancy, HIV/AIDS, and lack of sexuality education. Most schools attended by our respondents had no health facility, and the few that had clinics had inadequate and unfriendly staff and inadequate school drugstore. The study showed that adolescents have little or no access to youth-friendly services, even with their preference for government hospitals as their place of choice for seeking health services. We recommended that school health services be revamped by government to improve access to youth-friendly services geared towards identified health problems. Highlights of my contributions to humanity. Research engagement. Mr. Vice Chancellor, sir. My research achievements in this field and subspecialty can be capped as filling the gap in knowledge of major children's health issues and reproductive health issues among women and adolescents in this environment, thus enabling better preventive measures and best practices. I was also involved in training in community medicine at the MBBS program and the residency training program, training in public health at the undergraduate level, master's level, and PhD level, mentorship of my students and staff members, and community service engagement with our rural posting areas, our urban posting clinics, and also inclusive in several urban and rural health outreaches under the 7-day Adventist Church Evangelistic Outreaches as the health director for SDA Osun State Conference in the last quinquennium. Acknowledgements. All praises, glory and honor to my Lord Jesus. I especially thank the Trinity for the precious gift of life, favors undeserved, grace upon grace, and many providences and opportunities bestowed upon me, upon every aspect of my life. Great is thy faithfulness, O Lord. Your mercies indeed endures forever. My sincere appreciation goes to the Vice Chancellor of this university, Professor Odunayo Clement Adeboye, for giving me the privilege to deliver the 22nd inaugural lecture, for his support and the amiable way he engaged me in discussions to reach a decision on the choice of this glorious day. I thank the other principal officers of the university, the DVC ARI, Professor Kandi, the DVC Administration and Development, Professor Bede, the beautiful and elegant first female registrar of UniOsun, Mrs. Atinuke Ogutunde, the bossa, Mr. Lasisi, and the university librarian, Dr. Adeboye. I acknowledge and appreciate the pioneer Vice Chancellor of this university, Professor Shola Akinriyade, who chaired the panel that interviewed me for the position of Associate Professor at UniOsun, appointed me as Acting Head of Department of Community Medicine, and later as Acting Director, Quality Assurance for the university. I acknowledge and sincerely appreciate the immediate past Vice Chancellor, Professor Labode Popola, under whose administration I served the university as Director of Research and Linkages, Provost of the College of Health Sciences and Chairperson Ceremonials. My acknowledgement also goes to the former Vice Chancellor, Professor Okeshina, and former acting Vice Chancellors, Professor Olatunde and Professor Alani. I acknowledge all past and present governing councils of this university. I appreciate our immediate past Pro-Chancellor, Professor Yusuf Olaolu and his son, and the incumbent Pro-Chancellor, Professor Abiodun Adewale Olajipo. I acknowledge the immediate past DVC RA, Professor Kola Olusen, the immediate past Registrar, Alaji Shitu, a former Registrar, Dr. Fanny Rajepi, the immediate past acting University Librarian, Dr. Bostosho, the immediate past Bossa, Mr. Ferikwe, a former University Librarian, Mrs. Kaka, the immediate past Librarian, Mrs. Adewale, the immediate past Acting Registrar, Mr. Marcus Awobifa, and the immediate past Acting Bossa, Mr. Adams Hamid. My journey chasing the golden fleas brought me in contact with many people that impacted my life for good, and it also took me to many places. I would like to acknowledge and appreciate all my teachers at the Baptist Primary Day School, Irabiji, and at the Adventist Grammar School, Ede, and my classmates, AGS Class 72. Faculty members at the Adventist College of West Africa and the Middle East College, Lebanon, Beirut, Lebanon. All staff members of Seventh-day Adventist Church Mission Headquarters in Nicosia, Cyprus, and Cairo, Egypt, and Alexandria, Egypt, for their hospitality to a refugee student from Lebanon. Faculty members of Philippine Union College, Calocan City, faculty members at the Philemon and Choco Medical Foundation, Manila Central University, all my classmates, Class 82, especially my friend and sister, Professor Linda Lynn Varuna and Dr. Angelo Mushkulu. My sincere appreciation and gratitude go to the entire staff members of Arima Maternity Center, Arima Ibadan, where I served as a youth corporal and later retained as medical officer in charge. All staff members of Health Center at the Adventist Seminary of West Africa, now Benkassin Teaching Hospital, Babcock University, and served as medical director. I thank all for your cooperation and dedication to duty. All staff members of the Seventh-day Adventist Hospital, Ile-Ife, and at the postgraduate medical education sector. All staff members of the College of Health Sciences, Ladoke Akintola University of Technology, especially my colleagues then in the Department of Community Medicine. I acknowledge and appreciate my teachers and mentors at the postgraduate level, Professor Imade, Professor Nadepo, Professor Olubide, Professor Parakoyi, Professor Laoyi, Professor Mokodu, Professor Azizu, and all my friends and colleagues from the then PSM, UCH Ibadan, Professor Fawale, Professor Owaje, Professor Oshunbaje, and Professor Dainu. I especially like to acknowledge and appreciate a true friend and sister, Professor Ayo Fawale, who reviewed and edited this manuscript. And my gratitude also goes to Dr. T.F. Asekun-Olarinmoye in the same vein. I appreciate all my past and present students in the MBBS, Public Health and Residency Training programs, and especially my numerous beloved mentees. They are beloved, they are special. They rose up, they organized themselves all over the world, and they did exceedingly abundantly more than even what I can ask them to do for myself. The Bible says, "Lo, children are the heritage of the Lord. As arrows are in the hand of the mighty, so are they. Happy is the man that has his quivers full of them." You have all made the work memorable and have contributed immensely to my success story. I am truly blessed of the Lord. I acknowledge and appreciate appreciate all members of staff of the College of Health Sciences of this great university, where I have served once as a provost, and acknowledge the memory of our pioneer provost, late Professor T.A. Adewale. I acknowledge and appreciate the moral and financial support of some individuals and groups in the college. Special acknowledgement and appreciation go to my friend and sister, Professor P.O. Akinwusi, to the immediate past provost, Professor Alebiosu, to the present provost, Professor Ishawumi, to the acting provost and dean of Faculty of Clinical Sciences, Professor Adekale, the dean, Faculty of Basic Medical Sciences, Professor Terry Ali, the dean, Faculty of Basic Clinical Sciences, Professor Mabayoje, to the head of Department of Community Medicine, Professor Omishore, and my other colleagues in the Department of Community Medicine. Also, I acknowledge and appreciate Professor Josephine Uba, Professor Najimdin Adeleke, Professor Adioti, Professor Fadiora, Professor Komalafe, Professor Oyeyipo, Dr. Rabi, Dr. Azan, Dr. Abiodun, Dr. Franyi, and Dr. Adishini. I especially appreciate and acknowledge the following people in the university: Professor Sion Oyeweso, Professor Olukoya again, Professor T.R. Ajayi, Professor Idowu Akitayo, Professor Mansur Adeleke, Professor Ilesami, Professor Kizito Folarunsho, Professor Olaide Badamashi, and Dr. Abani Konda. I acknowledge and appreciate my church family to the glory of God. The Nigerian Union Conference of the Seventh-day Adventist Church, the Osho State Conference of the SDA Church, where I have been the health director pro bono for the past 2 quinquennium, all the members of all Seventh-day Adventist churches, branches in Oshobo, and my local church branch, Alafia SDA Church, Community Oshobo. A very special acknowledgement, appreciation, and gratitude to the founder and pro-chancellor of Adeleke University, Ede. Dr. Tajuddin Adeleke, a man with a very big heart, who has always been a pillar of strength for me and my family, both on our mountains and in our darkest valley seasons. I say a very big heartfelt thank you beyond what words can express. I am honored. I acknowledge and appreciate Chief Dr. Mrs. Dupe Adeleke Soni, the leader of Edeland. Also, Professor Solomon Adebola, the Vice Chancellor of Adeleke University, Dr. Bryant, Professor and Mrs. Atolabe, Pastor, Professor, and Dr. Mrs. Ola, Pastor, Dr. and Mrs. Efutade, and Alaji Lawal Badigeshi. I also appreciate Dr. Mrs. Bilikis Akile. I also acknowledge and appreciate Professor Ademola Tayo, the Vice Chancellor of Bangkok University, and his wife, Professor Grace Tayo, Professor Adeshegun Fatusi, Vice Chancellor of University of Medical Sciences, Ondo, Professor Obafemi Ajibola, former Pro-Chancellor of Osho State University, Professor Olufemi Ashalu, Vice Chancellor of University of Ilesha, Mr. Funsho Ojo, Registrar, University of Ilesha, Professor Idowu Olayinka, former Vice Chancellor, University of Ibadan, Professor James Makinde, former Vice Chancellor of Bangkok University, Professor Michael Faborodi, former Vice Chancellor of Obafemi Awolowo University, Professor Chukwu Okoro, Vice Chancellor of Hillside University of Sciences and Technology, Okemesi, Chief Dr. Mrs. Olufunke Agagu, Professor Ijaduola, a Vice Chancellor that is here, and Chief Mrs. Olufunke Agagu was the former First Lady of Ondo State, my big auntie and friend. My very special thanks to my royal fathers. His Royal Majesty Oba Adedokun Abolore, Honorable Officer, Your Majesty, sir, you are highly revered, loved, and deeply appreciated for who you are and all that you're doing for humanity. We are indeed very proud of you. It is a very big honor to have you here today. I also acknowledge and appreciate the KBSC, the Arabiji of Irabiji, ably represented by Otuba Wahab Adewoye. I acknowledge and appreciate the presence of Barrister Jola Akitola, the Osun State Commissioner for Health, Honorable Kashope Abolari, Osun Central Senatorial Wing, and Honorable Chairman of the House Committee on Health in Osun House of Assembly, Honorable Dipo Oluwale, Osun State Commissioner for Education, Elder Ayelege Aino, Head of Service, Osun State, his wife, Dr. Mrs. Wishona Aino, Commander Adekunle Ige, Professor Kolawole Owolabi, Honorable Idowu Abiodun. I'm very honored. There are so many people that I should mention here today, but time will not permit me. I say a big thank you to everybody. I say a big thank you to all the members of the 22nd Inaugural Lecture Planning Committee. I am forever grateful. I acknowledge and thank my siblings and their families, Mr. and Mrs. Dancy Oshundino, Mr. and Mrs. Shola Osundino, the Fadare family, especially Professor Femi Fadare in the US, he must be online, the Shodeke family, and the entire Oshundino dynasty of Okelawandi. I want to especially acknowledge and sincerely appreciate my children who have given me so much love, joy, and support. Thank you very much. Dr. Asekun-Olarinmoye, Engineer Oyebisi Asekun-Olarinmoye, Dr. Asekun-Olarinmoye, and my grandchildren, Pauline, Shane, and Bella. I acknowledge the sweet memory of my loving and selfless parents, late Pa Ephraim Adeyemi and late Madam Abigail Taiwo Oshundino. And likewise, I acknowledge the sweet memory of my darling husband, my soulmate for 40 years before he rested in the Lord, late Professor Olusegun Sholade Asekun-Olarinmoye. Great indeed is thy faithfulness, O Lord. I give all the glory and honor and adoration to my Lord and Savior Jesus Christ. This is a brief of my stewardship, Mr. Vice Chancellor, sir, and my distinguished audience and guests. I thank you all for your presence, physically and virtually, and for listening. God bless you all. Amen.
Just listened to an inaugural lecture. Round of applause again for the world is full today. I have the whole country here. The entire country is here in Shoko, in Valley, in State University. And the reason is not far-fetched. That man generates 50% of the total electricity that you consume in this country today is seated here. This man who will tell people, Emma Davisi Lam, you will the Dama Yelam, Wala Polo, Dr. Thank you very much. them seated around, but time will not permit me to be mentioning their names one by one. We have important visitors here also. We have a power commissioner for education. Honorable Inaugural is present powerfully here today. He has been here early in the morning for some state event. And I said, you will also come for the afternoon. So he's here for the afternoon shift. He's doing his afternoon shift now. He's my boss here. Thank you very much for coming, sir. I also have my own co-chancellor and chairman of the council of my own university, the University, Professor Shia Pugafar. You are welcome. Thank you so much for coming. I have the brand newly manufactured CLD of our own teaching hospital, Dr. Emmanuel Afolabi. You are welcome, CLD. Who is also a medical doctor. You went up the Alara of Araland. You are welcome, sir. Also, His Royal Majesty, I let you know about Dr. Akin Ogubangbe. That name is Ogubangbe. The overlook of the local nation. You are welcome, sir. Welcome. A very important person here today. The wife of the chief of staff is here, powerfully. Dr. Alhaja Balkis Akeleye, you are welcome, Madam. The boss at Deleke University. You are welcome. I'm sorry if I have missed out any name. Yes, to my comment on the inaugural lecture. Thank you, Professor Olarinmoye. And I want to thank you very much for coming to me always every morning to say this. When she was preparing for this lecture, I spoke with her. I said, Auntie Esther, there is something I would not like you to do when you get to the podium. And she said, what? I said, I wouldn't want you to look emotional when you want to acknowledge the contribution of your husband to your very life. And she said, listen, oh no, we promise you, you will get down. And I want to thank you for someone delivered an inaugural lecture here. Old man like me, remember this morning, I'm just taking to tears here. Thank you. The memory of the righteous is blessed. I want to end by saying that Mama Olarinmoye is a special specimen. And the reason is one, agility and humility. And two, uprightness in the face of money. You want to test a man who take in charge of money. You will know his weakness very, very quickly. Mama Olarinmoye handled our convocation for us. We gave her money, and she returned the excess to the coffers of the university. Because the state is powerfully represented here, that is one thing that we pride ourselves in here. Resource management. Without swelling our hands. And we will live up to that until we pass to the God beyond by the grace of God. Thanks for the lecture. And I will close by saying that your recommendation that sexual health education is primary for child health or even for adult health. And I will end with this short 1-minute story. When I was in secondary school, I was a very good mathematician, very good, really good. I solved all additional mathematics by Goodman, Tolbert and Goodman, into exercise book. I solved everything from page 1 to page 279. I solved it. So there were many ladies who are coming to me to learn mathematics. And the y the x is equal to f of x. My mother would say, "Oh no, you mountain." start learning. Then my mother, while going out, my mother will say, "Ọ̀dọ́mọ wọ̀ tó ẹ̀wà." Tọkùnrin àti obìnrin bá ti wà ní yàrá, èsù ló sì kẹta wọn. And I asked her, èsù ò sí bẹ̀ màmá. That time, she was speaking in the traditional tone that I did not understand. So, someone has to open this thing about sexual education to youth. Whether you teach it in the 4 walls of classroom or you don't, this thing has made the world so easy that they learn it from here. Then why don't we start teaching it at the primary level? On this note, I want to declare this to the second level.
Shall we please rise for the answers? National anthem.